All right, let's talk about seborrhoeic keratosis. Now, I know it's a mouthful, but it's one of the most common skin conditions out there and one you probably never heard of. The thing is, it causes a ton of unnecessary worry. So today, we're going to demystify. You know that moment, right? That little jolt of panic. You're just minding your own business, maybe looking in the mirror, or you just happen to glance down at your arm, and there it is, a new spot. And your mind just immediately starts racing with all the what-ifs. And look, this isn't just some hypothetical scenario. This happens every single day in doctors' offices all over the world. Someone comes in, points to one of these spots, and asks that one big question that's on their mind. Doc, is this cancer? Well, let's get into it.
Okay, so here's our game plan for this explainer. First, we're going to break down what these spots actually are. Then, we'll look at who gets them and why. After that, the big one, how to tell them apart from melanoma. And finally, we'll talk about what, if anything, you should do about them.
All right, first things first, let's get right to identifying the culprit here. What in the world is a seborrhoeic keratosis? Okay, the single most important word you need to hear is benign. That means it's non-cancerous, totally harmless. Really, just think of it as a little overgrowth, a cluster of normal skin cells. Now, the word tumor might sound scary, but in this case, it just means a growth, and it's a completely safe one.
So what's the #1 giveaway? It's this stuck-on look. Seriously, people often say it looks like a dab of wax or a little piece of clay that's just been pressed onto the skin. It doesn't look like it grew out of the skin, but rather on it.
And yeah, the texture is a big clue too. It's not smooth, it's usually a bit warty, maybe a little scaly or greasy, and it's definitely raised up from the rest of your skin. And all of that just adds to that classic pasted-on vibe we were talking about.
So what else should you look for? Well, for one, you rarely just get one. They tend to pop up in groups. You'll see them a lot on the torso, the face, the neck, and the color. It can be all over the map, from a light yellow to a really dark brown or even black. Oh, and here's a cool little detail for you. If you look really close, sometimes you can see these tiny, round, whitish-yellow spots on the surface. Doctors call them horn pearls.
Okay, so now we know what they look like. But the next big question is, who gets them? And why do they even show up in the first place?
Well, this timeline really tells the whole story, and it's a simple one. It's all about age. I mean, they're pretty uncommon before you hit 30, but once you get past 50, the likelihood just shoots up. And by the time you're 60, especially if you have lighter skin, they're just super common.
So what's behind them? Well, as we just saw, age is the #1 thing, the biggest factor, by a long shot. A lifetime of sun exposure definitely plays a role too. And then there's good old genetics. Yep, if your parents or grandparents had them, there's a good chance you'll get them too.
And really, this quote just says it all. You have to think of them not as a disease, but just as part of your skin aging. It's kind of like getting wrinkles or gray hair. It's just a totally normal, natural part of the process. Okay, let's get to the main event, the big question, the one that causes all the late-night Googling and the anxiety. How can you possibly know for sure that it isn't melanoma?
I mean, this is it, right? This is the fear that sends people straight to the doctor. You see a dark spot, it looks a little irregular, and your brain immediately jumps to the worst-case scenario, to everything you've ever heard about skin cancer. So let's break down the key differences. Okay, let's put these two side by side. On the one hand, you have the seborrhoeic keratosis. Remember that stuck-on, warty look? And the color is usually pretty uniform. Now look at melanoma. It's often smoother, and the color is a big red flag. You might see multiple shades, like brown, black, even red or blue, all in one spot. And it's almost always asymmetrical, meaning one half doesn't match the other. But here's the thing, just looking with your eyes can only get you so far. To really know for sure, dermatologists have a secret weapon. It's called a dermoscope. The best way to think of it is like a super-powered magnifying glass for your skin. It lets them look under the hood, so to speak, and see details that are totally invisible otherwise. So what are they looking for with this thing? Well, they're looking for the good guy clues. These are the classic signs of a harmless spot. Things like these tiny white or yellowish pearls, these little brownish holes on the surface, and get this, sometimes a texture that looks just like the squiggly surface of a brain. When a doctor sees these signs, it's a huge relief. It's incredibly reassuring. All right, so let's say you've got a confirmed diagnosis. The doctor says, yep, it's just a seborrhoeic keratosis. So the next logical question is, okay, what do we do about it now?
And here's the simple, wonderful answer.
Most of the time, you do absolutely nothing. That's right. Because they're harmless, treatment is totally optional. People usually only get them removed for cosmetic reasons, or, if one is in a really annoying spot where it gets irritated by clothing all the time.
But if you do want to treat it, the how really depends on the spot itself. Is it just kind of itchy or irritated? A simple topical cream can often soothe that right down. Is it one of the raised ones? A common way to handle that is a simple curettage, which is basically just shaving it off. And if it's flat, then cryotherapy or freezing it off is usually the way to go.
Now, of course, you should know that any treatment can have some side effects. The most common thing is a temporary change in your skin color right where the spot was. It might get a little lighter or a little darker for a while. Scarring, it's possible, but honestly, it's much less common with the techniques they use today.
And this number, well, it pretty much says it all, doesn't it? 0. That's how many follow-up appointments you need once a doctor has confirmed it's a seborrhoeic keratosis. That's it. You're done. It's harmless, it's going to stay harmless, and you can just forget about it.
But let's boil this entire thing down to the single most crucial point. Please listen to this. While these particular spots are harmless, you should never, ever try to diagnose a new or changing spot on your own. The bottom line is always this. If something is new, or if it's changing, the only way to be sure is to let a professional take a look. Period.
So in the end, you can think of these spots as just a part of your skin's story, little markers of time. But the real lesson here is that your skin is always communicating with you. The key is to actually listen when it tells you something new is happening. So I'll leave you with this question. What is your skin telling you?